business engagement on global health is essential because the type of issues that we're trying to address, extending health services and health access to resource-impoverished settings, won't be accomplished by any one sector. Certainly government has a key role to play, NGOs and international agencies have a key role to play, but the skills and the know-how of the private sector can make a demonstrable difference. And in our experience, when you work across sectors in a collaborative manner, you can tackle some of the most intractable problems, global health problems, and address them effectively. So I would say business has a particularly key role to play, certainly in technology and products and access, but also in know-how around fundamental health practices and laboratory practices and other areas where there's deep institutional knowledge within companies. At BD, we define forward our work in global health as being central to the strategy of the company, as it's been over the last decade, where we're focusing on enhancing clinical and laboratory practices in developing and emerging countries. Approximately 10 years ago, in fact, following a great delegation trip that I joined with Richard Holbrooke and at the time Health Secretary Tommy Thompson to visit 4 countries in sub-Saharan Africa to study the HIV/AIDS pandemic, we established global health as an area of specific strategic focus with a cross-cutting organization that works across the company's businesses and geographies around the world to drive global health strategy and positive outcomes. And this coordinates our work both affecting the laboratory, where we're involved, among other things, in immune system monitoring for people living with HIV/AIDS and advanced diagnostics for tuberculosis, but also into other areas of clinical practice, including training nurses on best practices, enhancing the safety for health workers, and also this is manifested through a large number of public-private partnerships that we're engaged in, involving clinical practice strengthening, laboratory system strengthening, and the health and well-being of health workers. Well, at BD, we've identified, as a number of other prominent leaders and organizations have done, that the health and well-being of girls and women is central to addressing some of the world's most intractable problems. And much of what we do affects healthcare generally, so we're serving general populations, women, children, of course men as well. But in recent years, we've become more focused on the needs of women and girls. And among the activities that we've been involved in is the partnership Together for Girls, which is specifically oriented towards addressing a key intractable problem, sexual violence against girls, that's an underlying driver of many of the world's most embedded health problems, public health problems, including spread of HIV/AIDS, teenage pregnancy, therefore maternal mortality, also affects girls dropping out of school, which affects overall development of societies. So that's one of the ways that we've become very involved. Another way is around cervical cancer. We're a partner in Pink Ribbon, Red Ribbon, which is to address breast and cervical cancer in developing countries, which are among the leading causes of death of young women, and there are very, very low rates of diagnosis and treatment occurring presently. Well, BD is involved in what might be considered a non-traditional partnership for a private sector organization, Together for Girls. This is actually a partnership that I founded. We launched in September of 2009 at the Clinton Global Initiative meeting. And the genesis of this was following 10 years of personal frontline experiences traveling to sub-Saharan Africa, perhaps 20 or 25 trips, and noting that while the world had mobilized to address the outcomes of HIV, people getting infected and therefore needing to be put on treatment, and to some degree the barriers to extending treatment access, particularly working on health system strengthening, that the underlying drivers of continued spread, which were more behavioral and societal, had not been yet really addressed. And through research and observation, we were able to determine that the way girls are treated in society has a major impact on the continued spread of infectious disease, as well as clear human rights implications. So because of our excellent network base and contacts, we were able to mobilize 5 UN agencies, UNICEF, UNAIDS, UNFPA, UN Women, and the WHO, 2 sections of the US government, PEPFAR, and the US Department of State Office of Global Women's Issues, and other partners such as the Centers for Disease Control, on addressing this issue really for the first time focused on sexual violence, specifically against girls and also against children more broadly. And this has advanced substantially since the launch. CDC and UNICEF had been working in one country, Swaziland, prior to the launch. We're now working in 9 countries, 5 in Africa, 3 in Asia, and also Haiti, on a combined set of methodologies to address this issue. Well, I think it's particularly critical that the private sector be involved in addressing the most difficult issues in the world. And global health is an ideal place to be focused because it's actionable, it serves the public good, and it also can create business opportunity. Most companies are seeing today that their growth in emerging markets is far faster than it is in the established industrialized markets. And by working on issues that are good for society, in partnership with governments and international agencies and NGOs, it can help position companies to really be adding value and it'll put them in a very different place than they would be if they're just going in to push their wares, so to speak. So I think it makes absolute sense, both from a society standpoint, but also from a commercial standpoint, for companies to devote their focus to addressing these issues.